Hi, everyone. So we'll get started right around 7:01, 7:02. I'll start with opening remarks. We're just letting everyone into the webinar right now. Thanks, everyone, for coming in. We'll just start in a few minutes. We're just allowing everyone time to log on to make sure that we don't start without them. All right, I'm going to go ahead and get started. And so good evening, everyone, and welcome to Navigating Mental Health and Chronic Illness, brought to you by NAMI Cook County North Suburban Cancer Wellness Center and Stephanie Aaron, Clinical Manager at Caner Wellness Center.
Hello, everyone. My name is Savina Chacheva. I'm the Program Director at the Cancer Wellness Center. I'm so glad that you can all join us this evening. For those of you who are joining for the first time, I would like to share more about the Cancer Wellness Center with you. The center was founded in 1989, is a nonprofit organization with the mission to help anyone touched by cancer find a way forward. Each year, our free counseling services, support groups, and health and nutrition programs serve over 2,000 community members of all ages and backgrounds. People with cancer, family members, friends, and caregivers all come to us to connect and cope. Our services, which are both virtual and in person, include education programs like the one this evening that aim to help you navigate the varied challenges that come with living with a cancer diagnosis. Wellness classes like yoga, meditation, nutrition, and more that provide a holistic approach to healthy living. And support services, which include counseling for individuals, families, couples, children, and those bereaved, as well as support groups that are designed to help our participants manage the mental and emotional impact of cancer. If you would like to learn more about the center and connect to our free programs and services, please visit cancerwellness.org, and I'll include the link in the chat. Thank you, NAMI, Cook County North Suburban, for partnering with us on this program, and welcome Heather to learn more about NAMI.
Hi, I'm Heather, the Outreach Manager at NAMI Cook County North Suburban. NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization providing public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can build better lives. We are a lifeline to individuals and family who do not know what to expect in their difficult journey. We offer classes, support groups, and do a lot of local advocacies for mental health. Our programs are free and open to those in the community, in our community service areas. We do not turn anyone away who is in need. We are pleased to have you all here tonight. This year, each month, mental health professionals will dig deep into a variety of topics to further educate us on community members' topics of interest. We have many requests to host a webinar to discuss chronic illness as it relates to mental health. Therefore, we asked Stephanie Aaron from Cancer Wellness Center to further educate us on this topic. Specifically, 1, to understand the mental health impacts of chronic illness with a focus on cancer, explore the social and emotional effects of chronic illness, learn effective strategies and tools for coping with emotional stress related to chronic illness. And according to the National Institute of Mental Health, people who have depression are at a higher risk of developing certain chronic diseases, including heart disease, diabetes, stroke, pain, osteoporosis, and Alzheimer's disease. According to the CDC, 51% of Parkinson's patients, 42% of cancer patients, and 27% of diabetes patients also have depression. It is apparent that your mental health can be drastically impacted if you experience a chronic illness. Stephanie Aaron's presentation will explore how chronic illnesses not only affect the body, but also have profound mental health implications. Stephanie will also explore how these illnesses can lead to anxiety, depression, and emotional stress, with a particular consideration for cancer. You will gain insight into the psychological effects of chronic illness and how they can manifest for people with cancer. Stephanie will introduce tools and coping strategies to manage these emotional challenges and improve overall well-being, fostering a more holistic approach to care. Our Q&A will be held at the end of the presentation. However, if you would like to type questions in the Q&A box during our conversation, please do so. I will read out the questions at the end, depending on how much time that we have. We do have until 8:30 tonight. Our guest speaker tonight, Stephanie Aaron, is a licensed clinical social worker who earned her degree from the University of Chicago after working as a medical social worker with both children and adults in a hospital setting. She joined the Cancer Wellness Center in 2022, where she is now the clinical manager. In addition to her administrative duties, she provides individual counseling and facilitates various support groups for people with a cancer diagnosis and their loved ones. Stephanie is passionate about addressing the emotional and psychological needs of people with cancer. Some of her professional interests include managing patient and caregiver stress, decreasing anxiety, and addressing grief and loss. We are thrilled to have her tonight to further educate us on this ever important topic. I'm honored to honor our guest speaker tonight, Stephanie Aaron.
Thank you so much. Let's go ahead and make sure you all can see this. Well, it is wonderful to be here. Thank you all so much. I really appreciate the opportunity to come and speak with you all and talk a little bit more about navigating mental health and chronic illness. As you heard, my name is Stephanie Aaron, and I'm the clinical manager at Cancer Wellness, and really here to talk about the impact and the way that the two can impact each other in terms of navigating chronic illness and mental health. And we'll take a specific look at how cancer plays into that. So I know managing a chronic illness can be overwhelming. So the fact that you're here, that you're taking time to learn more says a lot about your strength and resilience already. We're gonna explore a little bit about what doesn't really get talked about enough, or at least as much as it could or should, the emotional and mental toll of chronic illness. It's not just about physical symptoms. Chronic illness touches every part of your life, your relationships, your career, your energy, and your sense of identity. And as a mental health professional who works with people with a cancer diagnosis, I want to share some insights, validate your experiences, and most importantly, give you some tools and strategies, hopefully, that can help you feel a little bit more in control. This isn't about fixing anything. It's about acknowledging why it's hard and hopefully find some ways to support your well-being, both mentally and emotionally. So first, let's start with a shared definition, because I think chronic illness can mean a lot of different things to different people. A chronic illness, for the purpose of tonight, is any condition that lasts longer than a year and requires ongoing medical care, or maybe limits your daily life, a lot of times both. So some examples that we heard about before that you may be familiar with are diabetes, heart disease, cancer, others like autoimmune diseases like lupus or MS, rheumatoid arthritis, can be less visible, but just as life-altering. Many chronic illnesses aren't curable. So that means when someone receives a diagnosis, there's that shift from focusing on cure to really thinking about, how do I manage this thing that's going to be with me for the rest of my life? And managing something that is long-term is emotionally exhausting, especially when it affects your daily routine, your energy, and sometimes even how people treat you. So I want to explore the kinds of stress that chronic illness can bring. First, there's the persistent physical discomfort, thinking about things like pain, fatigue, neuropathy, or other symptoms that might arise either from the illness itself or a lot of times from treatment too. And when you're experiencing symptoms most days, it's going to take a mental toll. You might feel like you're having to wake up and just constantly push through something. Then there's the disruption to your daily life. Maybe you had to give up a job, stop driving or kind of shift household roles around. And that, of course, can impact your confidence, your self-worth. And let's not forget the fear of, well, lots of different fears, right? Fears of flare-ups, of symptoms getting worse, of becoming dependent on others. It can present in a variety of ways. So, lastly, there's the reduced independence or mobility that I wanted to touch on, and how that not only impacts how much you're able to get around, but absolutely your sense of identity too. And all of these stressors can really build up over time. Um, you know, of course, they're not just in your head, they're real, they deserve attention, they deserve compassion, and they deserve to be addressed in the same way that any physical symptom would. Chronic illness often changes your relationships and your sense of self. You may no longer be able to be a caregiver. You might not be able to be the breadwinner or the social organizer of your circle. There are a lot of different aspects of your identity that can be impacted, and that can lead to a lot of grief. Not thinking about grief for someone else, but for the version of you and who you are and all the things that you miss. Many people tell me that they feel isolated even when they're surrounded by other people. It can be hard for people to understand what you're going through. Sometimes you feel like you have to pretend that you're fine, or worse, like your symptoms are minimized because they're invisible. There are things like shame, embarrassment, or fear of judgment that can keep people from really opening up. Even if intellectually you know that there's no reason to feel, shame, embarrassment, etc., it's a lot harder to allow that to sink in emotionally. But I want to make sure you can all hear this clearly, that of course your experience is real and you are certainly not the only person experiencing this. When I think about chronic illness and mental health and the stressors that go along with all, one of the most overlooked pieces of chronic illness is financial stress. So even with insurance, medications, and treatment, the cost just adds up. Things like transportation to and from appointments, maybe you have to pay for parking at a hospital. Sometimes there's unpaid time off. Sometimes you have to take time off from work altogether. These all lead to financial hardships, and we call this financial toxicity. It's not just a money issue, it's a mental health issue. Financial strains can lead to anxiety, depression, sometimes even delay of care. You might find yourself having to make impossible choices sometimes, like skipping appointments or rationing medication. And, of course, we know that's not okay. And that's why mental health support to help manage these stressors really must be a part of chronic illness care. So let's talk a little bit more directly about mental health. We heard at the beginning some statistics about how common things like depression are amongst people with chronic illnesses. And we actually think that those statistics are even higher, just not always screened for or reported. Depression, we think, can be 2 to 3 times more common in people with chronic illness, and that's exhausting. It limits your freedom, and some medications or conditions even increase the risk biologically. So there's a lot of reasons that can lead to depression being more likely with a chronic illness. With anxiety, it's also, incredibly common. People worry about symptoms, test results, what their future holds, and that kind of anxiety can be chronic, just like the illness itself. And then there are things like adjustment disorders. Not everyone may be familiar with those, but if you're feeling overwhelmed, tearful, angry, lost when you're first diagnosed, or when your condition has a sudden change and you're having that kind of difficult time coping with that adjustment, it's of course a very normal response to a major life disruption, but that doesn't change how hard it is. What's important to remember is that mental health challenges aren't a character flaw, obviously. It's not that you're not strong enough. It's not that you're not trying hard enough. They're a natural reaction to a very difficult ongoing situation. So as you heard, we'll kind of look at cancer specifically and the relationship and impact of those stressors with mental health. At Cancer Wellness Center, we support people with a cancer diagnosis or those who are either in treatment, have faced a diagnosis, a family member, et cetera. And the emotional impact can bring about some unique challenges. And of course, are also a lot of overlap with other chronic illnesses as well. Cancer can feel like an existential threat. It often comes with sudden life changes, with surgeries, chemo, hair loss, pain, endless appointments. And emotionally, you might feel fear or grief, anger. A lot of times there's this sense of your body betraying you. And sometimes people feel emotionally numb or disassociated even sometimes. And, it's understandable that that's how our brain copes when we experience trauma. We're just trying to survive, and your body will do absolutely anything to help you just get through. And while cancer treatment focuses heavily on the physical, mental health support isn't always talked about. It's almost always an afterthought if it's brought up at all. And that really needs to change. So I'd like to give the example of thinking about either new diagnosis education or chemo education. So for anyone with us tonight who has had chemotherapy, there's usually a day when you go into your to see your medical team, you sit down with either a nurse educator or a doctor, and you learn about your treatment. You learn about the different medications, you learn about what your schedule is going to be like, and you spend a long time talking about potential side effects and all the scary things that can happen. You may hear about things like nausea, hair loss, neuropathy, low blood counts, etc. And you'll talk about ways to kind of combat those symptoms, but rarely are mental health effects of cancer treatment talked about at that time. And those are some of the most common side effects of treatment. And, the same goes for a lot of other chronic illnesses as well. There can be differing effects mentally and emotionally that are common depending on where in the diagnosis or treatment journey someone is. So we'll kind of take a look at different aspects of that journey. I know not everyone loves that word, so bear with me. The moment of diagnosis can often really feel surreal. You might remember where you were or when you got or what happened when you got the news. Maybe you felt shock, disbelief. Sometimes there's that numbness that I mentioned. Sometimes people cry. Sometimes people feel nothing. A lot of times people will go into this like survival mode often and process those emotions later. Can feel like a total loss of control that comes with a new diagnosis, and it can present in a variety of ways. It can be that no matter how much you work out or how well you eat, you're not able to be in charge of your disease management, right? A lot of those things can reduce your risk for a lot of illnesses, but ultimately a lot of those things are out of our control. Sometimes that sense of loss of control happens with your medical appointments. It can be feeling like, your sense of body is really turned into that patient, people poking and prodding you. You don't always get to say, yes or no to that. You can feel a loss of control with scheduling, medical appointments, how often, when, where, and all of this together, you can just feel so untethered. And of course, family members too go through a lot of stress when a loved one has any chronic illness, and including a cancer diagnosis. They carry emotional weight. Sometimes they try to be strong for you, but they're also scared and anxious. Obviously, the diagnosis impacts everyone, and a lot of times for the people with that illness, you may be worrying about the people around you as well, right? Not just how does this impact me? How is this going to impact all of them? So after diagnosis, during treatment, like a lot of other chronic illnesses, treatment can be grueling. There's chemo, maybe radiation, immunotherapy, surgery. They all come with side effects that drain your energy. They can drain your appetite, your sleep, your mood. And I like to remind people that energy isn't just for physical tasks, things like walking, moving around. You really need mental and emotional energy too. And those things are finite. So if you're using your energy on getting out of bed, on healing, on showering, I mean, how many people have felt like getting out of a shower, they ran a marathon or, had a true aerobic exercise, because taking off your clothes, turning on the water, getting in, washing your hair really, really can take a toll when you're experiencing something like cancer or a chronic illness. And it doesn't leave a lot of energy left to care for things like worries or fears. A lot of times, people that I'm meeting with will come to me and say that they find themselves being snippy with others, and they hate it because that's not who you want to be, right? And they can't understand why. I remind them, of course, that on top of everything, they're going through a lot, but also having patience takes energy, and patience with a neighbor or a stranger in line who's talking about, the intricacies of their days, whatever it is, it's going to be low on the totem pole when you're thinking about how to survive your day. When your body's under stress, your brain is too. It can also be isolating physically as well as emotionally. Maybe you don't have the energy to be with others, like we said. Maybe you're not able to get out because you feel like you can't walk or stand as well. And sometimes you feel fine, but your immune system prevents it. Having low blood counts makes being around others dangerous and can force you to isolate as well. And all of those together contribute to why someone with a cancer diagnosis or chronic illness may be more vulnerable to depression. And it doesn't stop there. As we've mentioned, people live in fear of cancer coming back, of treatments failing, and that fear doesn't fade even if the treatment stops. Thinking about after treatment, what comes next? I want to talk a little bit about that post-treatment, whatever that means for you, mental health and cancer survivors. And before I do, I want to recognize that even the word survivorship itself can carry a lot of baggage for people. When I'm talking about that today, we're thinking of that post-treatment phase. Survivorship is a stage people don't always talk about. When you sit down in the beginning with your doctor, the focus understandably is going to be on making sure you learn, everything you can about your diagnosis and what treatment's going to be like. And it's all a shock, and they're not trying to overload you with information, so it makes sense. But that means that talk about survivorship and long-term effects can get pushed aside and neglected. You may be done with treatment, but emotionally, things still feel fragile. So many people have to just kind of put their head down, get through treatment one day at a time, And it's not until that like rush of active treatment is over that they even begin to process everything that they've been through. It can be really difficult when friends or family are excited and celebrating, or maybe they're happy to say, so you're done, right? Or isn't this great? Or you did it, you're done. And that's not often how people feel. There can be a whole discussion on pro cons of things like chemo bells or ways to celebrate being done with treatment. But when everyone is happy around you and you don't always feel the same way, you might ask yourself, why don't I feel better? What's wrong with me? Or maybe you feel guilty for not being more grateful or sad that there isn't that sense of relief that you were so hoping for and expecting, right? A lot of times there's that expectation that if you can cross that finish line, you can just breathe. And for a lot of people, that's not the case. That's not their experience. And that's a loss in itself. These emotions are, of course, normal. Many people have post-treatment experiences like PTSD-like symptoms, whether it's flashbacks, nightmares, extreme vigilance around symptoms. It can be really, really hard when every little twinge or pain is not just a reminder of everything you've been through, but a worry. It's a fear, is it back? Is it growing? What's going to happen next? And then there's survivor's guilt, asking why you lived and others didn't. These feelings can be isolating and hard, but they're all incredibly common. So addressing long-term effects of a diagnosis, even post-treatment, is truly essential. I want to talk a little bit about grief and cancer and chronic illness in general. I am giving a talk on this topic next week at Cancer Wellness Center, so if there happens to be anyone here who plans to join, you'll get a little bit of a spoiler. I apologize. But when we talk about grief, a lot of times people associate that with a loss of a loved one, but grief can really come from so many different kinds of losses, right? The loss of the life we once knew or were expecting to have. And living with chronic illness often brings about this quiet type of grief, the kind that maybe isn't always visible to others, or others don't know or understand that you're experiencing, but it can weigh really heavily on you. You might find yourself grieving things like your former independence, your career goals, family goals, energy levels, the ability to do simple everyday things without pain or exhaustion. And there are so many different kinds of losses that compound and make it all the heavier sometimes. Whenever I talk about grief, I like to use the analogy of grief jars. So if you take a look at the jars at the top, the jar with that big ball inside, we think of grief like that grief is all-consuming, and we, being the jar, are just filled to the brim with it. It's totally filled us up, and it's hard to imagine it ever won't be like that. A lot of times, people have the expectation that over time the grief will shrink and get smaller, but that's not often what people experience. The loss doesn't change, the grief doesn't always change, but I like to think of it in the second way, that the size of the grief or the grief may still be there, be the same, but you, the jar, it gets bigger. We grow around it. We figure out ways to take it with us, and to have more room for it in our life with other things. So what do we do with all of this? We've established that with chronic illnesses, there are really good reasons to pay attention to mental health. But what can we do? First, I want to say to lean into support systems, and that can be friends, family, or a support group of people who get it. You don't have to explain your experience from scratch with people who might share that diagnosis. They can just understand that shared understanding can be really helpful. And second, consider professional help. Therapy, of course, is not just for crisis. It can be really helpful to build resilience and process grief or reduce anxiety. Social workers and counselors in hospitals can be a really phenomenal place to start with that. And third, think about emotional outlets. So things like journaling, mindfulness, maybe prayer or a creative hobby, whatever's going to be right for you. They're not just extras, they're tools for regulating stress and processing emotions. And then finally, building routine and structure. Chronic illness often brings chaos, right? So creating any kind of predictable rhythm, even in really small ways, can help your mind feel safer. So let's take a little bit of a look into each of these and some suggestions that, of course, everyone's going to be different, but might be worth giving a try. So first, with support systems, it starts with allowing others to help. One thing I always like to recommend is to keep a running list of things that you need to do with absolutely everything on it. Everything from driving to and from appointments, picking up certain groceries or thinking about recipes you want to make, the medications you need, maybe walking the dog, picking up kids to and from school, cleaning a bathroom. It could include purchasing a wig or things like getting new shirts so that your port could be accessed more easily. Having all of these things in one place as they pop up in your mind as, an added thing that I need to do can be really helpful when others ask, how can I help you? It can be hard enough to allow others to help. I recognize so many people that I meet with are the caregivers usually themselves. They are not used to being in this position. They are not used to asking for help. So it's hard enough to get yourself to that place. And then oftentimes, if you do, you don't even know what could be helpful. So many times people say, I'm here. I'm here if you need me. I'm here to help. How can I help? And it can feel strange to know what to say to that. So one thing I suggest is to have that list and say something as simple as, I really appreciate you offering. I'm not sure there's anything for you to do, but I do keep a list of everything that I need done. And you're certainly welcome to look and see if there's anything you'd feel comfortable completing for me. Otherwise, just knowing you're here for support is really appreciated. Something like that can give people a concrete task. It allows them to pick what they're comfortable with. It gives them an out so you don't have to feel like, you're being a burden, which I know a lot of people worry about. But I would really encourage everyone to think about a time that they had someone in their life that they helped, or when someone else in your life was going through a tough time. It's hard to know what to say. It's hard to know what is going to be helpful. If someone allows you to help them, it can feel really good. So remind yourself that it is not just something that is good for you to let other people help. It can be good for them too, right? It can feel good to feel like you're making a difference in a situation where you don't have a lot of control. Next, thinking about professional help. Seeking out resources. Most hospital systems and treatment centers have social workers, financial associates, a lot of people who are there to help. And many can tell you about financial resources, both within the hospital setting and externally within the community, that could be useful. Sometimes people are able to help with things like completing Social Security or disability paperwork. A lot of times, they have experts in knowing those community resources that you might be able to reach out to. They can talk about financial assistance for things like medical bills. Sometimes diagnosis specific, but sometimes there's also organizations that can help offset some of those costs of the illness by paying for things like utilities or maybe another bill or parking temporarily. And, hopefully they can connect you to resources like Cancer Wellness Center, like NAMI, that can provide professional support. Even someone with the best support system who tells their friends and their family absolutely everything can still sometimes feel like they're doing like mental gymnastics when they're having a conversation of thinking about, how is the information that I'm saying impacting that person? And are they in a space where they can take this on? Is now the right time? How much should I share? When should I share it? And that's exhausting. Um, Sometimes talking to a therapist is the only place where people don't feel like they have to think about that other person, and how they're receiving information in itself can be useful. It could be a time to vent, to process, and hopefully explore coping tools as well that are specific to you. And, in addition to therapists, of course, there are doctors who can prescribe medication as well. There's absolutely a stigma that exists for both therapy and for medications, but seeing a psychiatrist or taking medication for things like anxiety or depression can really make a big difference in the right setting. I'd like to remind people that often we don't think twice about things like anti-nausea medication or pain medication. But for some reason, when it comes to things like anti-anxiety medication, there's that block. It feels different, but just because you can get through without it doesn't mean you should have to. So talking with someone who can recommend what might be best for you can be valuable. In terms of healthy outlets, finding something restorative, whether journaling, meditation, yoga, maybe listening to music, drawing, or taking a walk around the block, finding whatever is going to fill you up and make all of those things a part of your treatment. So for some people, it might not be any of those things. It could be reading for 30 minutes. It could be calling a friend every day. Whatever it is, that at the end of the day, it's not going to deplete you. It's going to make you feel good, is important to incorporate. Instead of viewing these things as extras, as sometimes people see it as being selfish, as me time, treat them as you would any other piece of your medicine routine, your treatment plan that would address other side effects of your illness, and do them as routinely as you would take Zofran or whatever it is, right? Incorporate those things as an important piece of your plan. One thing that I would like to suggest when possible is finding a way to get out in nature. Now, I know that may not be possible, but going for walks has tremendous physical and mental benefits. Even if you're not able to walk, if you're able to get into nature or watch nature on YouTube, that can have positive effects as well. There's a Japanese practice called forest bathing, not bathing like water, but bathing in the sense of bathing in beauty and wonder of nature, has tremendous health benefits. There's Dr. Lee in Japan, who's president of the Japanese Society of Forest Medicine, who has really been the pioneer in this research. And there has been a ton of really positive things coming out of that being in nature and forests can lower your blood pressure. It can slow your heart rate and increase heart rate variability. It can speed up digestion. It can lower stress hormones like cortisol and adrenaline. It can suppress sympathetic nerve system's fight or flight response. It enhances your parasympathetic nervous system recovery mode. It increases your sleep time, improves like your vigor, your energy, and reduces feelings of fatigue. Something impressive that I heard was that it can even specifically boost an immune cell, your NK cells in your body, to help with immune function. And I mean, wow, what a great list of things when you're battling a chronic illness to be able to help support yourself. Now, obviously, forests are not available for everyone, but so many of these things are also increased and benefits of being able to walk around, to move around, or if you're limited in your mobility, being able to listen to these sounds or watch these sounds, things like YouTube, can also have positive effects. And lastly, I want to talk about routine and structure in these recommendations. So this can be really hard when your whole life as you know it changes, but finding ways to break up the day, to have some consistencies when possible, can really make such a difference, right? Thinking about feeling untethered, like nothing is in your control, having things that are predictable to you, that you can have that ownership over, can create that sense of safety. It might look like calling someone at the same time every day, or taking in the middle of the day to go do something you like. Maybe it's having a wake-up routine or a wind-down routine. So maybe you spend 30 minutes every morning drinking tea or coffee with breakfast, or maybe you have the same specific routine at night after dinner, something as small as really paying attention to the way you brush your teeth and wash your face can go a long way to feeling like self-care. Even on days when you don't have energy to really do anything or feel well enough to be up walking around, finding ways to break up your day location-wise can be really useful. So sometimes I'll suggest, if you're able to in your space, to set a time to get out of bed. And maybe that means then laying on the couch in the morning and then picking a time to maybe have a meal. And then maybe you move to a chair to lounge or rest in for the afternoon. Trying to use these different locations to break up your day, so that way by the time you get back in bed, your mind knows, okay, it's nighttime, it's sleep time. It's great for sleep hygiene, but it also can provide some sense of structure in a time where so much can feel like it's just blending together. And that's really helpful mentally. So I always like to kind of close with practicing self-compassion, speaking to yourself kindly, and replacing harsh self-talk with the voice of a supportive friend. Be gentle. You're doing your best. Think about, when you have those frustrations with yourself, why can't I? Why shouldn't I? Why is it just? Try and take a step back and think, if a friend told me they were going through this, what would I say? Allow yourself to rest without guilt. I know that can be a really difficult thing for a lot of people, especially, if you're used to being a go-getter, you're used to doing all these things, kind of getting things done. It's important to make sure that you are not seeing rest as laziness. It's not. It's healing, right? Your body and your mind deserve care. Um, I know it's hard when it feels like there are so many things to do, but resting is being productive. It's allowing your body to heal. And that is, in fact, probably, the number one priority on your list. And then also thinking about, what are your expectations for yourself and trying to release any unrealistic expectations. Perfection isn't the goal. Progress and self-respect are. So it can be really, really hard to think about the you before your diagnosis. It can be really hard not to compare, but instead of comparing yourself to what you were like before your diagnosis, I would encourage you to try shifting to thinking about some of your hardest days, the days where you couldn't get out of bed, where you would not have been able to join a Zoom like you're doing tonight, and recognize that progress. It's not always linear, and it's not certainly as fast as we want it often, but it can be really helpful to notice that there has been change, and that can kind of create some hope that things can continue to change as well. So to wrap up, living with chronic illness means managing more than just physical symptoms. It affects how you think, how you feel, how you relate, and how you live. Your emotional health matters just as much as your physical health. And there's no shame in feeling like you're struggling. There's no weakness, of course, in asking for help or for support. You deserve support, you deserve care, and you deserve compassion, not just from others, but from yourself too. So I want to thank you for showing up for yourself today. I hope something you heard here either made you feel a little more understood or maybe you even found it helpful. Thank you very much.
Thank you, Stephanie, for your wonderful presentation. And I think we have one question right now. It says, are there resources for cancer also helpful for those with other chronic illnesses, or are they specific for those with just cancer?
It's a great question. So it kind of depends on what kinds of resources and which organizations you're talking about. There, any of the recommendations in terms of things that can be helpful from a mental health perspective, I would say pretty broadly are going to be helpful to anyone with a chronic illness. Obviously, there's no one size fit all mental health support for each person, but yes, by and large, a lot of those things overlap and can be useful. I do want to recognize that there are certain disease-specific organizations that fund financial support and things like that, and that can be really tricky. But when we're talking about mental health, absolutely.
I had a question. What if you know someone that is going through like a second round of cancer, and you know that they could probably, because of you have your own mental health condition, recommended like medicine for them for their mental health, but they turned you down. Is there another way of like going about that, or how would you look at that situation?
Yeah, it's a great question. And I appreciate you asking that because it's a really hard situation. Kind of two things. First, I would say it is obviously always important to respect other people and their wishes, but sometimes being able to deliver that message in the why of your intent. I really care about you and see X, Y, and Z. And this is something that can help alleviate those things that you're experiencing. Ultimately, it's your decision, but if you are interested in knowing more or want support, even just giving them that information or that connection can help make that barrier kind of a little less and a little easier. So kind of leading with the why can sometimes be your ticket in.
Oh, during your presentation, you talked a lot about the person who had cancer and the implications for that person. But what about I know we kind of touched on the caregiver a little bit, but what if the caregiver, they, I know that you said that they could reach out for help, this is what you could help me with the list. And I thought that was a really great way of bringing that up. But what if you are noticing that the caregiver is also not doing well mentally either? Is there something else that you can do other than, saying something? Like, do you have any other things that maybe you've had a patient or someone you worked with, it worked for them?
Yeah, absolutely. Every situation is going to be different in terms of what's going on and what's happening. And so it kind of depends on, I always like to start with the person who's experiencing the chronic illness, what they feel comfortable with. If you feel comfortable talking about it and wanting to share and kind of commiserate together, saying that, acknowledging that, this is something that neither of us asked for, neither of us deserve, and I know it's impacting both of us. I would really love to talk about it because it helps to hear how it's impacting you too, if that's something you're open to. Understandably, sometimes people want to have that conversation. Sometimes people just want others to know that I'm worried about you, but I can't take that on right now. And that's okay too, right? And it's okay to say that, to say, I want to just take some time. I know we talk a lot about, my illness, my disease, but I know that it absolutely impacts you too. And, I don't always have the time or the space to be able to talk about it, but here are some resources that I hope you'll look into because I really care about you and know this is absolutely impacting you. Even just the acknowledgement can be helpful.
Yeah. I had another question from the audience. It says, suggestions to break out of a depressed or other negative mindsets. I think they're looking for something maybe like positive affirmations, like I can do hard things or I'm safe. Do you have anything that works for a majority of your patients or anything like that?
Yeah, that's a great question. I love where you were going with that in talking about things like having those positive affirmations or phrases that you can come up with ahead of time and kind of have ready when you feel like you are in a good space to kind of look through. A lot of people will have them on your phone, like in a notes app, so you can just kind of take that time, take a step back, read them, try and remind yourself that what you're feeling isn't what you're is temporary, right? But trying to recognize too that like where that self-judgment is sometimes can be really helpful. Maybe you feel really down or like you're having a hard time. Even just noticing how often you're getting frustrated about that fact and trying to start with saying, yeah, I'm feeling that way. And that's hard. It makes it that much harder when you're like, why can't I get over that? Why can't I do that? So that sometimes can be a really helpful place to start with those kind of more low moments.
Yeah, a little self-compassion goes a long way, right?
Absolutely.
I think that's all the questions that we have for tonight. So thank you, Stephanie, so much. We
You.
appreciate you. It's all great information. I'm going to read our wrap-up information and then we'll go ahead and close out for tonight. So if you enjoyed tonight's program, you can find more information about upcoming programs and events at www.namiccns.org. Our next family to family class will be held from July 10th to September 4th at CJBS in Northbrook on Thursdays from 6 to 8:30 p.m. More information as registration can be found on our website. If you have taken our family to family class or attended one of our family support groups, please consider attending our family insight evenings held on the first Wednesday of each month at St. Joseph's Church in Wilmette. More information can be found on our website. Our annual gala is rapidly approaching. This year's gala will be held on May 3rd at Sunset Ridge Country Club in Northbrook. Get your tickets now by visiting our website. Once you log off, you will see a brief survey that will allow us to better understand your comfort level with today's topic, as well as provide us with information we need to raise money to continue providing free mental health services in Cook County North Suburban area. We appreciate your presence tonight, and we look forward to seeing you again at a NAMI CCNS community webinar. Please take care of yourself and each other. Thank you, everyone. Have a good night.
Thanks, everyone.
Thank you again, Stephanie. All right, bye.